First of all, as you all may know, I have a disclaimer since I am a consultant for Ceramtech, which is the manufacturer of the Bilox Delta ceramic. Let me start with what you call fretting corrosion. I don't want to go too much in detail of the mechanism. I think you heard a lot of publications and presentations about that. But let me speak about two perspectives what can occur if you have fretting corrosion in a hip system. First of all, we have what you call the technical perspective. You can imagine that the damage of the taper is so strong that you can have a fracture of the taper, as you can see here on the right-hand side on top. But this is actually very seldom. More critical is what we call the biological perspective, with all the effects associated with the corrosion products of the organism. As also mentioned before by Dr. Narinder, that we have metallic wear debris produced, corrosion products, ions, and all this causes the problematic of metallosis and ALTR. So that's a serious issue that we try to avoid. If you look in the recent literature about the occurrence of fretting corrosion in vivo, you see that following the different publications, we can have up to 4.2% of revision with metal and polyethylene articulation, specifically due to fretting and corrosion. It was a much higher rate with metal on metal, due also to the fact that the metal on metal create all these ion aspects and coming in their interaction between the head, femoral ball head, and the taper of the stem. So we can ask us three questions. What about the qualitative corrosion on the stems? Are they the same if you have a stem using a ceramic ball head versus a metallic head? What about the quantitative corrosion? From where exactly comes all this material loss? Is it coming from the taper of the ball heads or the taper of the stem? Especially knowing that, as mentioned previously, the hardness of a ceramic is much higher as cobalt chrome, so maybe we can expect to have more fretting and corrosion than cobalt chrome. And finally, what about the issue for a sleeve ceramic, which I would like to come a bit more in detail at the end of my presentation. But let me start with the so-called qualitative aspect. For that, we concentrate on one of the first publications by Steve Court, specifically on the retrieved analysis of 50 ceramic ball heads and 50 metallic ball heads in a matched pair patient. We exclude the metal, and we wanted to see exactly what happened in this situation. So they use what we call the Higgs score, which is a qualitative scoring system that you can see on the right-hand side. Notice 1 to 4, 1 being no fretting corrosion, 2 mild fretting corrosion, 3 moderate, and 4 severe. And this is now represented on this graphic with the axis 1 to 4. And what you can see is two groups. On the pink side is the retrieved found with the ceramic ball heads, and the blue side with the cobalt chrome ball heads. So if you look just in the average, you can see that the blue are higher in average than the pink one. You see qualitatively there was more fretting corrosion observed by using metallic head than ceramic heads. If you look now more specifically on the material of the stems, which is shown here, if you use what we call the conventional titanium aluminum material with vanadium, we have much less fretting corrosion than with the TMZ depth, which is also called the beta titanium, which is a more flexible alloy and was creating a lot of fretting corrosion. There is actually also another study by the group of Tan, which was also analyzing retrievals. There were two groups in this study. First of all, ceramic versus cobalt chrome, and oxidized zirconium versus cobalt chrome. The intent of this study was to study the effect of the taper design, specifically the size of the taper, the depth of the trunnion, the implantation time on the fretting corrosion issue. So they used for their analysis 52 ceramic head versus 52 cobalt chrome heads, which is about the same as the study of Steve Kurtz. And also with the group of oxidized zirconium, there were 8 oxidized zirconium versus 8 cobalt chrome. I should say from a statistical relevance, is a bit too low to make a very secure conclusions on the study. Anyway, they came to the conclusion that the taper design, specifically the taper size and the implantation time, has a significant effect on the tribal corrosion. That means the longer you have the hip in vivo, the higher the risk to have fretting corrosion, and the smaller the taper size, the higher the risk, because you have a higher torque acting on the taper of the stem coming from the ball heads. For the first group, they found clearly there was a significant lower median fretting and corrosion score on the ceramic heads than cobalt chrome. In the second group, between the zirconium and cobalt chrome, there's still no differences between the two groups. And finally, they came to the conclusion that the using ceramic heads may offer advantages in terms of fretting and corrosion. Let me go now to the second aspect. What about the quantitative corrosion? From where does it come? Again, we refer to the study of Steve course, the same study as was done before with the 50 heads and the 50 heads for ceramic and 50 cobalt chrome heads. And now they analyze more in detail the loss of material coming now either on the left-hand side from the taper of the stem, or as you can see on the right-hand side from the taper of the head. It was clear to see on this picture that on the right side, that most of the material loss come from the ball head, about 10 times more than the material loss from the taper of the stem. And remember, if you speak about ball heads, and specifically about cobalt chrome ball heads, most of the metal that you use, the ions, is cobalt and chrome, and this is exactly all the problematic that you observe with metal on metal. If you look on the left-hand side with the loss of the material from the taper of the stem, we see with the pink version a slightly bit less loss of the material compared to the cobalt chrome. If you look now, again, based on the taper of the head, on the pink side, there is absolutely no loss of material coming from the ceramic ball heads. What about the fretting corrosion if you speak about sleeve ceramic? So sleeve ceramic, just to make it clear, if you see the picture on the top right side of the slide, this is a ceramic system which has a sleeve which is principally developed for the revision system, and I will go a bit more in detail a bit later on that. But as you can imagine, Ceramtech, before launching this product on the market, has done a lot of testing in vitro, specifically also about the fretting and corrosion. And what we can see with up to 10 million cycles, there was no occurrence of fretting or corrosion, thanks to the fact actually that the sleeves were made in titanium, aluminum, vanadium alloy. There's also a retrieval study going on this aspect and analyzing now an both interface, because by having a sleeve you have one supplementary interface. You have now an interface between the ball head and the sleeve, and between the sleeve and the stem. And they analyze now the level of fretting corrosion. But they came to the conclusion that in these two only studies that exist up to now about this analysis on the Bilux option system, the time of implantation and the number of implants was too short to make a conclusion very clear. But let me show some pictures coming from these retrievals. First of all, some example of fretting corrosion scores from the interface between the stem taper and the tape inside of the sleeve. So on the left-hand side, one, no fretting corrosion, mild and moderate. That's what they can find. And if you look on the outside of the sleeve, that means now in contact with the ceramic ball head, only 2 levels of fretting corrosion has been observed. No fretting corrosion on the left side and the mild one. Let me go a bit more about the discussion about the Bilux option, especially that it will come more and more on the market and also in India. So this is a system of ball heads from sizes 28 millimeter in diameter up to 48, and comes with different sleeve size, S, M, L, XL, in order to adapt the leg length of the patient. The only statistic that I can show is based on the February 2017, but more than 500,000 systems has been implanted worldwide up to date. But let me go about this slide, which is the most important to understand exactly the role and the advantage of using this kind of design if you have some problems with the taper. So using Bilux option system, we can categorize this in 3 groups. First, during the primary total hip arthroplasty, during the surgery, or during a cup revision, and finally, which is also the reason mainly that has been developed, during a fracture of the ceramic. Let me start with the left-hand side. You can imagine that during a primary hip surgery, for any reason, you can have a taper damage occurring with an instrument. And if you have a damage on the surface of the taper, you create locally a kind of scratch. And this is strongly recommended to not use a ceramic ball heads, because we know that locally you have an increase of the stress, which can strongly reduce or increase, let's say, the risk of fracture of the ceramic ball head. So this is always recommended to have it in case something like this occurs during the surgery. Now let me look at the second situation, the situation of a cup revision with the assumptions that you want to preserve the stem. The stem is nicely fixed, is not loose. And so what you do if you change the ball head, then you have to use a sleeve if you want to use a ceramic ball head. This can occur in a different situation. You can have imagine that you just want to change the neck length of the stem. You want to change the head size, or we want to change from polyethylene insert to ceramic liner, and so on and so forth. For this reason, because you cannot use a normal ceramic ball head on a damaged taper, you would need absolutely to use the Bilux option system. And finally, if you look on the third situation, in the case of fractures, then you need to change, of course, the ceramic liner. Sometimes also the head can fracture. And in this situation, you need to have a ceramic liner used with the Bilux option. But there is some limitation. The sleeve system has some limitation in the case, as you can see in these three schematic pictures of the deformation that you can have during on the stem of the taper. If you imagine that you put the sleeve on the taper of the stem and you have a waggling and you feel the impression is not stable, then you also recommend to not use this system and most probably to change the stem. But if it's too difficult to really change the stem, then to use a ball head in metal. Now, the same situation with some pictures in vivo on the left-hand side, where the Bilux option can be used. You see the taper of the stem is still okay. Here on the right-hand side, the taper has been deformed and is not safe to use the Bilux option system. Why and what should be done in case of a fracture of a ceramic and you make an exchange? First of all, you have to perform a thorough debridement, jet lavage, and synectovy, because actually it is impossible to get rid of all these ceramic particles. Most of them you can see, they are large enough. If you do the synectovy, it will take a lot away, but there's a lot of microscopic particles which will still remain inside the articulation. That means if you use after a combination of a metallic ball heads against a polyethylene, for instance, with the presence of this ceramic particle, you kind creating a grinding machine and you create really a problem. And I will show you after a lot of publications speaking about that. So the metal head must absolutely not be used when you have replacement after a ceramic fracture. From a tribological point of view, the best situation is to use a ceramic on ceramic, because then this remaining ceramic particle will not affect the articulation and the wear issue. And the second best solution is to have ceramic on high-cross polyethylene. We also have some cases that we can show that the ceramic particle, which still remains in vivo in the articulation, comes embedded in the polyethylene, but does not affect now the scratch surface and the scratch resistance of the ceramic. So again, and that's the most important slide maybe here, speaking about the Bilux option after revision of a fracture of a ceramic, never use a metallic ball head as a replacement. There's plenty of publications out there as a literature. Here's some example speaking about the situation that you have to avoid that. If you look just the last one in 2012, there was a single case study. There was a clearly intoxication of the patient up to death due to the fact that the metal on polyethylene was being used after ceramic fracture, and half of the metallic head disappeared and created a big metallosis in the articulation of the patient. So this brings me already to the conclusion of my presentation. You have to remember that fretting corrosion occurs up to 4.2% of all cases of revisions. The ceramic heads can mitigate the damage, and the material loss comes mainly from the stem taper and is independent of the stem material. The material loss from the metal head comes mainly from the taper of the ball head, and that's always cobalt chrome, and the magnitude higher than that from the taper of the stem. So in that conclusion, we believe that ceramic heads are resistant to corrosion. And finally, even the use of ceramic ball heads are reducing the risk of fretting corrosion. This is why, if you look now at the recent literature speaking about the issue of fretting and corrosion, they clearly propose the fact that you have to use ceramic instead of metallic head, even though with metal and polyethylene. And now I'm more than happy to discuss a bit more in detail in taper in general and in tribology and bearing surfaces also. Thank you.